Hi, come on in. I'm Dr. Remarkable. It's nice to meet you. Go ahead and make yourself comfortable. How are you doing today? Okay, that's great. Today I'm just going to ask you a few questions so that I can get to know you a little better and understand what's been going on. I'll be entering some notes into your intake form as we talk. Let's start with your name. And what would you like me to call you? Perfect. What are your pronouns? Thank you. And how old are you? Okay. Thank you. I have everything I need there. Now I'd like to hear a little bit more about what brought you in today. So, what brings you in? Mm-hmm. And how long have you been feeling this way? I see. And what made you decide to reach out for therapy now? Mm-hmm. Okay. Thank you for sharing that with me. I'd like to get a little better understanding of what's been going on in your life recently. What would you say has been your biggest source of stress lately? Okay. And how has that been affecting your day to day life? What about your sleep, work, or school? Mm. What about other relationships, friendships, family based relationships, and so forth? That's okay, take your time. That gives me a better idea of what things have been like for you. I'd like to ask you a little more about how you've been feeling emotionally. How would you describe your mood lately? Would you say you've mostly been feeling sad, anxious, overwhelmed, irritable, or anything else I may not have mentioned? Or maybe it's a combination. And how often do you feel that way? Would you say occasionally, most days, every other day? Most days? Okay, thank you. I'd also like to ask you about anxiety. Have you been feeling more anxious or worried than usual? And when you're feeling anxious, what do you notice? For example, do you experience racing thoughts or any physical symptoms such as headaches or dizziness? Okay, I see. Sometimes when we're dealing with a lot of stress or anxiety, it can affect things like sleep and energy. So I'd like to ask you a few questions about that. How have you been sleeping lately? And I know we briefly touched on sleep earlier, but I am really wanting to know if there are any troubles with falling asleep or staying asleep. Both? And how about your appetite? Any changes recently? Hmm. And what about your energy levels? Feel tired most days? That's understandable with what you've mentioned so far. Thank you. How has your concentration been? Meaning, do you find it difficult to focus or stay on task? Mm-hmm. Thank you. I'd also like to ask about any previous experience you've had with therapy. Have you ever been in therapy before? And how was that experience for you? Was there anything you found particularly helpful? I see. Anything you'd like to do differently this time? I'd also like to learn a little bit about the people you have in your life. Who would you say you feel most comfortable talking to when things get difficult? For instance, a friend, family member, or partner. Okay. And And do you feel like you have a good support system? Or do you sometimes feel like you're handling things on your own? Okay. And when you're feeling overwhelmed, what do you usually do to cope? For instance, do you go on walks, engage in art, listen to music, just anything you feel will help you calm down or think through things before reacting? We can explore some additional coping strategies together as we continue. Now, I'm going to ask you a couple of questions that I ask everyone as part of the intake process. Have you had any thoughts about hurting yourself? Okay. And have you had any thoughts about not wanting to be here anymore? Thank you for being honest with me. I appreciate you answering those questions. I'd like to end by talking a little bit about what you'd like to get out of therapy. What would you like to accomplish during our time together? Mm-hmm. What would you like to be different in your life? What would you like to focus on first? For instance, I have some clients who tend to start with self love, some choose to focus on childhood experiences. It is your choice, of course. That's a good one. Those sound like some good things for us to work towards. I think I have a pretty good idea of what you'd like to focus on. Before you go, let's get your next appointment scheduled. Let me pull up my calendar. Okay, I have an opening next Tuesday afternoon or Thursday morning. Which works better for you? Thursday morning? Perfect. Okay, you're all set. Your next appointment is scheduled. I'll see you then. Please be sure to take care of yourself, and I look forward to seeing you and getting to know you better. Bye for now.